Hi everybody. So my name's Rachel Dorsey-Campbell. I'm one of the 6 pharmacists, I think it is, that we have in the room today, which is great. And I've been asked to just give you a quick talk on a project that I've been working on. I've done very little of the work. The people listed here, Anthony, Sue, Thomas and Amanda, we've been working on trying to pull together a tool that tries to look at DMT monitoring around the country, and hopefully there'll be some useful output for you. So I work at Imperial, where I'm part of the MS DMT, and I actually am a prescriber of disease-modifying therapies at Imperial. And I spend a lot of my time chasing up blood tests for people on DMTs, which is why I was asked to contribute to this. So depending how you count them, we've got increasing number of DMTs now. We all know this, with different monitoring schedules. This is great. We've got increasing choice for patients and clinicians. And the drugs are becoming more effective, but that comes at increased risk for some of them that we all know about, and for that reason we're all doing blood tests on our patients on a daily basis. But that activity is not funded, it's not commissioned for, it's something that it's based on the goodwill of mostly the MS nurses in the service, and we all know that that is a huge burden on the services that we work within. So what are the issues around DMT monitoring? Well, if you break them down, as I've just said, the activity is not actually funded for. So NHS England paid for the cost of the drugs, and that's it. They don't pay for anything else. The outpatient attendances are covered by CCG tariffs, but the actual activity around ordering blood tests, making sure the patient has the blood test, interpreting those and acting on them if they're abnormal, is not specifically commissioned for. And then because of that, different services have come up with different models to try and help cope with that. So that ranges from an Excel spreadsheet, that somebody may be managing their monitoring on an Excel spreadsheet, using their electronic patient records. If you can drag results out of your trust system into another system, there's Dawn, which is a third-party IT solution, which helps some trusts to do that. And some trusts are using pharma-funded solutions, so things like phlebotomy services, which go out to the patient's home and take the bloods. But that is the variation across the country, is that everybody's trying to fix this problem locally within the way that works for them. And that's got an impact on the MS nurse workforce and the pharmacists who are working in MS. And it takes nurses away from patient-facing duties, as we've heard several times. A lot of the nurses' time is spent chasing blood tests. And as was just mentioned in the last, at the end of the last talk there about dragging pathology results from one computer system onto another is a huge challenge, and we all know the NHS IT doesn't talk to each other. So we have patients on DMT. We have about 1,500 patients on DMTs at Imperial, and they come from 93 different CCGs. I manage a home care team who are trying to chase blood test results from all over the country, and we get them in a variety of ways. A good old-fashioned paper fax. We have iPhone pictures of patients' results emailed to us, and we have to try to collate that into a system that's safe, and it's not. So we need a better solution than that. So you've all seen the graphs with the data that's been used for several presentations now on the amount of money that is spent on these drugs. So what we've done in this pilot, just to develop this tool, is use that data. There was 12 months of data from Bluteq. I think it was 16, 17, so it will be missing some of the newer stuff. We looked at the total spend on each disease-modifying therapy, and then divided the costs of those by the cost of the product to estimate a number of patients on treatment. Well, I will say straight away that I know this is going to be an underestimate, because for lots of reasons, lots of patients aren't on Bluteq, or the drug costs that were used are the list price and not the actual price. But it gives you a good idea of what the costs are of this monitoring. So there are several caveats. Some of these drugs may be stopped within the first 5 years. There'll be differing blood monitoring regimes depending on if the blood tests are abnormal. They may be more frequent. And we've assumed a 10% growth in DMTs. So these are the numbers. Essentially, it's totaled that we have, say, in year 1 in the country, 20,000 patients on treatment. So as I said, it's an underestimate. But if you average out the number of blood tests per year on each treatment, you're looking at 85,000 blood tests in year 1. And the cost of that for the phlebotomy tariff alone, just to draw the blood and send it to the lab, is £350,000 in the first year. And then that goes up to £400,000 in year 5. So that's just the tests. That doesn't take into account the staff time. So we've attempted, using a community MS nurse model, to sort of break down how many minutes they were spending on each aspect of that job. And again, some assumptions are made about banding, but just to give you an idea, we've used an MS band 7 time, and if the bloods are normal, that's costing the NHS £1 million a year in nursing time, £1.1 million a year, 1.6 if you add in the cost of the actual blood test. And as you can see, that goes down considerably if you split that time with a band 4 admin person, which is obviously a more sensible thing to be doing. So I don't expect you to read all the detail on this, but this is just the tool that's been developed to try and look at this. This is the background to it, so this is the spreadsheet. So if you enter in the number of blood tests that you do as a service per month, this spreadsheet, very cleverly designed, not by me, I have to add, Amanda, will tell you how many hours that is taking in man hours. And that can be used in your service then to sort of demonstrate how many hours a week, a month. And this is only 50 a month. I say we've got a lot of people on treatment, but I've worked out we do 22 blood tests a day at our trust. So the number of hours chasing those is considerably more than that. So just to run through, I won't go through all these, but yeah, the issues are that we know DMT monitoring is a huge burden, and we're all dealing with it in various ways. Ideally, we would like a national solution. That's, would be the ideal. There's lots of reasons why we need to crack this. We've talked about patient safety. And with the talk yesterday from Gert started off with the fact that a lot of what we do in neurology is not funded and not coded properly, and I think this is an area that we really should look at.
It's quite frightening, actually, to see how much hidden costs there are in terms of the monitoring. It's incredible. Any quick comments on the burden of DMT monitoring and the costs?
Oh, sorry, Amanda's waving the paper at me. I forgot to tell you that on each table there is a sign-up sheet. So if any of you wanted to be involved in using this tool, the tool is going to be available on the Academy website. I should have said that as well. So you can go on and access it. But if you'd like to be involved in the project for reasons of confidentiality, we have to get you to consent to us contacting you. So if you just sign the sheet on the table.